New Zealand has taken the next big steps in trying to become smoke-free by 2025. The Smoke-Free Environments and Regulated Products Amendment Bill has passed its first reading in Parliament. It will make it illegal for anyone born after 2009 to purchase tobacco and drastically reduce the number of shops who sell it. Nicotine levels in tobacco will also be cut down. Well, for more on this, let's bring in Anaru Wā. He's with the Department of Public Health at the University of Otago. Kia ora, Anaru. Thanks very much for joining us tonight. Look, there are some pretty bold measures in this bill. What do you think will make the biggest impact in terms of achieving the smoke-free goal?
Well, I think the most impactful measure will be the one that takes most of the nicotine out of tobacco, so very low nicotine cigarettes. It will have a huge impact on people wanting to smoke. The other measures, such as reducing access through retail and smoke-free generation, are really important because they send really clear messages about, what's normal about smoking, and really support the main one, which is very low nicotine cigarettes.
OK, you've looked at the modelling. What kind of reduction in smoking can we expect if these changes do become law?
Well, the goal is to get below 5%, and the goal has always been to try and do that by 2025. The modelling suggests that it might be just after that, but still, when we introduce these measures, the modelling suggests that smoking rates would pretty much drop off a cliff, and they would reduce, say for Māori, which have some of the highest smoking rates, they reduce from about 20% to about 6% by 2025, I think, and then for the general population, they'll be well below that. So, really quick reductions within a year or two, I'd say.
Yeah, massive changes. What about the cost? On the one hand, the government will, of course, collect less tax, but there will be savings for the health system, won't there?
Huge savings for the health system. Less people needing to go into hospital for treatment, less people taking time off work, all that sort of thing. But with a healthier workforce, we're going to get huge benefits in terms of more people working longer, living longer, healthier lives, and all those sorts of things. So I think the benefits far outweigh the tax argument, which is kind of strange too, because you think it's a bit of a nasty tax on ill health. So I think it's really good benefits.
So what about the gains in terms of health and life expectancy, as you've mentioned, particularly in Māori?
Well, this is, for me, one of the really exciting things, because for Māori, one of the big movers or reasons why we've been so supportive of this is to address health inequities. And so the modelling that myself and my colleagues were involved with suggests by about 2040 that for all causes of death, if we take those into account, this would reduce the difference between Māori and non-Māori women by 20% and 23%, and for Māori men about 10%. So it's a huge reduction, and we just can't really see those sorts of impacts on health inequities in a lot of other measures. So I think it's a really sort of important piece of legislation for our health in general.
OK, great. We'll have to see how it tracks through the parliamentary process. Anaru, thanks very much for your time tonight.
Kia ora, thank you.